everyone. Welcome to Health Impact Live. This is Megan Antonelli, and I am excited to be with my guest here today, Lorren Pettit. Lorren is a digital health product management executive whose fingertips are on some of the most significant assessment frameworks shaping American healthcare, from the HIMSS EMR adoption model to Chime's Digital Health Most Wired program. Lorren has been instrumental in creating the roadmaps that health systems use to measure and advance their technology maturity. Now, as head of the Smart Community Builder Initiative, he is tackling perhaps the most complex challenge yet, helping organizations navigate their journey from human-directed care to supervised autonomous environments. Lorren, welcome to the show.
Thank you, Megan. Glad to be here.
And so, I'm so excited to have you. Tell us a little bit about the Smart Healthcare Alliance. Is it the Smart Hospital Alliance? I just realized I don't have it in my notes.
It's the Smart Healthcare Alliance.
I had it right first. Smart Healthcare Alliance.
The Smart Healthcare Alliance is actually a new not-for-profit alliance that was formed at the end of last year, beginning of this year, under the direction of CEO Steve Lieber, formerly of HIMSS. So we have a really good track record of somebody who's been there and done that. The Smart Hospital or the Smart Health Alliance is actually home to the Smart Hospital maturation model. And again, if you're familiar with the HIMSS and the EMR adoption model, we have actually replicated in many ways some of those learnings that both Steve and I had HIMSS and Chime of now applying that type of mindset and those type of tools for the smart hospital environment.
Yeah, that's amazing. Steve is such a great guy, and he's been really at the forefront of this. And I think it's so important, even as we think about just the role HIMSS has played in this evolution, and of course, Chime in helping hospitals, really adopt and, embrace the technology, and then of course get recognized and kind of create that element where they, not only obviously want to do this from a patient and improvement standpoint, but where we can recognize and look to them. So kudos to you and to him for doing that. And I think as we look at this development of smart hospitals, which tell me a little bit, because smart hospitals and that word has been around for a while. When you are using it, what does that look like? What are we talking about?
Yeah. It's one of those things, again, in healthcare, we use a lot of buzzwords. And so we have to be very careful that we are purposeful and intentional what we mean. So I will sort of differentiate between a smart hospital and, let's say, a digitally advanced hospital. Where digitally advanced hospital is actually using technology in the care of patients, and it could be the CPOE, this clinical practitioner order entry, different technologies. With the smart hospital, we're actually leveraging the technology to be more from a predictive standpoint. So, for example, when we have a patient that has propensity to fall, we have those different technologies in place, the ambient technologies that are monitoring and being able to predict, let's say, the patient's gait, the propensity for bed sores, et cetera, those type of things that can actually sort of be predictive and get ahead of the curve so that we are actually preventing these type of negative outcomes. That would be just an example.
Mm-hmm. Yeah, no, and I think it's an important distinction, and as we've watched the hospital, sort of digital transformation of healthcare in general, that sort of hospital unbound to, virtual health and hospital at home, as well as, what is going in the hospital. And I think you've mentioned this a little bit in terms of that a lot of other outside of the United States where hospitals are sort of being newly built, they tend to be a little bit more, ahead of the curve, whereas we're still, dealing with some legacy buildings that, maybe aren't ready for this yet.
Absolutely. Yeah. And if I can say sort of like the Indonesia and Malaysia, they've been laying down the runway for smart hospitals. And so we certainly have an eye towards what's going on over there. I will just sort of say, we talked about the EMR adoption model and the smart hospital. One of the things that was really propelled the EMR adoption model was meaningful use. And we had a lot of money that was being thrown towards hospitals in terms of their adoption and use. And so EMR, the MRAM, as we called it, really was at the right moment for it to take off because it became this roadmap for organizations and the hospital CIOs. They could have all this money. What could they do? And they needed to have a pathway. It's really sort of hard to think that we will ever be able to replicate that type of experience. That said, though, that what we did with the MRAM has been be able to provide that sort of roadmap, a guide, and as well as benchmarking, so you can sort of see. And so that's what we've been doing with the smart hospital and with maturation model. And again, keeping an eye towards what has been going over in Malaysia and Indonesia, and that's been really instructive. But we also have our own stamp here in the United States and Western society. And so to be able to really sort of see how culture, how people, the domain, for example, part of the smart hospital, plays really significantly in really sort of the adoption and really sort of direction of how hospitals really will be adopting the smart hospital.
Right. Well, and to sort of dig a little bit deeper into that, tell me a little bit about, when you look at what a stage 1 hospital looks like right now in that maturity model versus a stage 5, where are we now, or where is that stage 1 hospital and where are they going?
Yes. So just in terms of the nomenclature, we're having been hymns, chime, we would call them stages and hymns and levels at chime. We were very purposeful to really to have our own stamp. And so we actually call them leaps. We're moving from leap 1, leap 2, leap 3 up through 5. I'll just sort of give you a little bit of background too. Having been instrumental in developing a number of these models, 7 stage at chime, or at hymns, 10 levels at chime. We really were very purposeful of trying to go with a 5 model, stages or levels, if you will, right? Or leaps. And part of that was just to keep it simple. And if, again, not to get too wonky, but we do know in a lot of the maturation model world, you can go, a level, so many different partitions. A lot of them go with 5 stages because there's an element of trying to keep it simple. And so that was part of a driver for us. To your point, though, in terms of where organization, what does a Leap 1 organization looks like? Where we are in terms of just the evolution of digital health in the United States, we're already starting off with sort of a base understanding that organizations are digitally capable in terms of they have the EHR. That's sort of almost the entry level, and so and we don't see really organizations nowadays that don't have an EHR. So that's, one of the factors. As we move up, we're looking in terms of being able to integrate, the technology, CPOE with digital imaging. So those type of things are understood. That's like a level 2. Like a leap 3 is really around that context awareness automation, so that we're coordinating workflows and again becoming a little bit more smarter with the efficiencies in the organization. A lot of times it's more operational. And then a leap 4 would be leading towards, I'd say, sort of the cognitive support. So really more in terms of AI guided decisions that would be helping the clinicians as they work along. And then really the leap 5 is what we call that sort of supervised autonomy. Here we have AI, which becomes really sort of initiates some of the care, with within guidelines and guidance, as well as human oversight. But it becomes the technology is being much more involved in the process.
That makes me think. I actually, in the conversations that we've been having to kind of prep for our conference next week, around, when EHRs were implemented, and they were system wide and not highly specialized. A lot of the AI tools and a lot of the pilots that are being done sort of departmentally, right, in a specialty area. So when you look at across an organization and when you're making those evaluations, are you looking for pockets of excellence in a certain department or across an org?
Yeah, that's a great question. So let me sort of give you a little bit of a context too, of just the historical, having been involved inside like the MRAM with HIMSS. One of the learnings that we had was that we imputed a capability in one unit to the rest of the organization. And we've certainly found some, pushback against that, appropriately so. So that makes sort of sense as the evolution of and the adoption of technology came along. We would pilot it in one area and get the kinks out, and then to be able to extend it to the enterprise wide. That's the same sort of learning that we've had now and applying it here with the smart hospital. We are interested in the capability. Do you have that capability in the organization to do, AI, with translation services, for example? But also we look at it sort of twofold. How extensive is it being used? Is it, just in the ED, or is it being, put on the floor too with those capabilities? The other part is use. And this may sort of sound funny, but, you can have technology, but are you using it? And again, having been, this is not my first rodeo. I've certainly learned that we really have to take into account the usability factor. And so capability, we can score you and give you points if you're thinking about the model itself, give you points for that you have a capability, but it's those additional points of, how widespread is it? Is it being used in a piloted or is it enterprise wide? And ultimately, the idea is that it would be enterprise wide for most technologies. There are some that are going to be, localized, and we recognize that too.
Yeah. Yeah. And I think it goes back to the sort of conversation that we have often around people, process, technology, and you can have the technology, but until you get to the culture and the processes, do you get from the implementation to actual adoption to transformation, right? And of course, you're an author, right? I think you have a book around cultivating digital culture, right?
Yes.
So from that, tell us a little bit about what you think, culturally it's going to take to get hospitals to kind of move to this smarter space.
Yes, culture, again, just from a personal standpoint, has been a real big interest of mine. And so one of the things, as relates to the smart hospital and with AI, I want to say that there's a lot of fear. There's a potential fear, let me put it that way, potential fear of the use of AI. Now, we are been like, culturally have been, our society has been like a bullet going, we are adopting it, we're using it, but there are those concerns around, well, so many concerns. But, one of the things I like to hone in on is, from a clinician standpoint, their fear of being replaced. Is the adoption of this technology going to put me on the unemployment line? Those are very legitimate fears. And so as an organization, starts to adopt and say that we're going to head into toward being a smart hospital, it is really important that we bring the clinicians and staff along. In many ways, again, what we want to be able to do, and this is just not selling it, but it's really true, is that technology, this AI, can actually help clinicians work at the top of their license. Again, that's a term that we're buzzing around, but it truly is to be able to allowed a lot of clinicians actually go into, remember, for altruistic reasons. That's a lot of real driver where people, really want to get into being a nurse or a doctor. It is for altruistic purposes. As organizations have moved towards being high tech, we're still like the high touch. And I really believe that what the smart hospital is going to allow us to actually really balance high tech and high touch together. But it's to be able to bring people along with that.
Yeah. Yeah, and I think that's so important. And I mean, again, and I don't mean to keep, but it's learning the lessons the mistakes that were made kind of in EHR adoption as we look at this next transformation that's going to happen across the organization. And, I think we didn't predict the challenges that the friction between physicians and nurses and the EHR well enough. And this with the adoption of AI and kind of that discussion of an autonomous, system, the fear is there, right? Culturally. And so everybody's been addressing it for a long time. And at the same time, only recently do I think we're actually seeing technologies that the clinicians feel are truly helping them.
Correct. And if I may just sort of add one to that too, one of the main learnings too from, the adoption of the EMR was that a lot of organizations, CIOs, went ahead without really bringing in like the clinicians, getting their feedback, their input, and again, I sort of get it. It's like, hey, we've got these great tools to support you. Look what we've done for you. But as a clinician, it's like, this is my practice. This is my license on the line. You need to bring me along. And so I think we're seeing organizations that are moving down that smart hospital pathway. They've been burned by the EHR experience. And so they're being actually smarter,
Right.
as they're moving forward with the smart hospital approach.
Sure. And so with the Smart Health Alliance and the health systems that you're working with and sort of seeing these ambient, intelligent implementations and what's working, what's not, tell us a little bit about where you see, the best progress. Where are some bright spots in that, in that where, you would say to a health system CEO who's looking to make these moves, like, this is a good first move. These are the, you don't have to mention actual companies, but like the technologies that are most promising that are, being adopted and making people happy in the organization.
Yeah. So more globally, the AI has really been in healthcare has really been used in the safe areas, not, quote unquote safe areas, right? But, revenue cycle management, being able for data exchange and doing the pre-authorizations, things that are really sort of have been safe. And again, it makes sort of sense is that you want to be able to test the waters, see how it works, get those bugs out so that you're not putting patient lives directly at risk. So we've seen some great, success in there, but clinically we are starting to see areas too, right? So with radiology and imaging, being able to sort of call through all these, myriad of images to be able to sort of percolate to the top, those that are suspect, those ones that really, prioritize for human attention and intervention right away. So those are sort of successes. I would also sort of point to in terms of the ICU, where we're seeing, sort of like the alarms and there's been like that alarm fatigue. So some of the technologies in that area to be able to really reduce that alarm fatigue. I married a nurse. Very, very thankful for these, types of interventions. Areas that were, still sort of under progress would be, things such like the ambient, sort of the voice areas, being able to block out some of the other noise that gets into the way. And so, that's one of the areas I find that work is still yet to be done. And then one of the areas that's also really surprising is I would sort of put it around how hospitals are actually using the AI to be able to redirect the cleaning staff, to be able to look efficiencies and really cue them up in the appropriate areas. A non-clinical area, but we know how clinical, how significant having the room ready is for, getting people out of the ED, out of, the hallway medicine that has been so rampant in
Yeah.
certain quarters. So
Yeah, we
that's
were
real
just
significant.
having, it's this conversation around kind of, you want to take the most innovative technology and apply it to the most innovative area. And, but the reality is that there's a lot of broken things and a lot of gaps and a lot of things to fix that, if
Correct.
fixed, would then allow for better care, streamlining patient care, and so this push and pull between kind of, fixing small, less exciting things that, are broken to, real, what, you might term as kind of innovation and kind of finding that place. I mean, I have it in that, like, curating the conference, the program, and you're thinking, oh, you want to have it, we want to cure cancer, and we want to improve the patient
Right.
experience, we want to do this, but getting them their food on time in a cheap and efficient manner could also be, a great thing. Right.
It leads towards, patient compliance,
Mm-hmm.
right? That, you
Absolutely.
got them on, you're on their side, and that compliance works towards ultimately patient outcomes and the like. So it's really just, it builds off of one another. Absolutely.
Yeah. When looking, in our last kind of few minutes, I had a funny experience recently. Uh, I actually I got to tour the Chargers practice facility here in Los Angeles.
Mm.
And as I'm touring it and sort of, going, ooh, football, and this is fun, what I realized as I walked through it was, in fact, that it was a $500 million building designed to keep these people healthy, right? The gym is the biggest. The field is the biggest, but the gym is this unbelievable setup where their workouts are tracked. Their, things are tracked. Their cafeteria, their foods are tracked. They put the foods in, the macros go to their app. I mean, it's
Mhm.
literally a healthcare facility, whether they, want to phrase it that
Like it
way.
or not.
They certainly don't want to call it that. But that, to me, walking through, is what I saw. So when we think about what that smart hospital looks like and what the future looks like, where we want to both fix the healthcare system that is, we say all the time, is a sick care system. And then we have, what does the hospital of the future look like? Or, to make it not impossible to answer the question, just the healthcare facility that makes sense to people,
Mhm. Mhm.
that does that, both from a prevention standpoint, but also, of course, from a caring for sick people. How does that all kind of come together? What, when you
Yeah.
think about that vision?
I'm going to answer it in two ways. One, I think from the hospital standpoint, the smart hospital, it still sort of will be a central hub where we will still have acute episodes, and it will be the place that people and society looks towards for interventions and like. I do believe, though, that we'll start to see areas of coordination, more of a hub, if you will. So the hospital at home, we've talked about, that's a growing area, right? Being able to remote care is going to be a real significant part, all tied back to where the acute component is, and where, to be perfectly honest, right, that's where the greatest dollar spend investment is going to occur. If you do it there, and then it's going to trickle out, because we know. I'll answer this also in another way. And this is again from a personal standpoint interest. My first master's is in gerontology, study of old age. I have had a long standing interest in the senior population and senior care. I do believe, and again, I'm very intimately aware of CMS's, their 5-star program for the nursing home, and how they calculate it, the measures and all that. I'm going somewhere with this, is that um, the nursing home is probably one of the areas where we have the best data, truly publicly available data, on the relationship between staffing levels, the input, and quality measures. Now, you think of it from a factory standpoint, labor input creates output, widgets. It's the same type of thing that we think about in healthcare. We have labor input creating quality output. As we bring in AI into the nursing home, that environment, better than any other else that we have out there, will be able to really uncover the true efficiencies that AI in a smart hospital, smart technology can bring in. Because right now, we're dealing in a world where there's a lot of promise of technology that with AI, agentic, it will produce this. Theoretically, it makes sense. We saw the same thing with the EMR adoption model, right? It was that you get to a late stage 7 and you get, all these outcomes. But we didn't really have the data for that. Now, with the nursing home, again, I'm most intimate with this versus any other place. We have the data that looks at the hours per resident day for nurses, LPN, CNAs, to be able to then look at that as an impact and output on quality, being able to see the introduction of what ambient technologies will bring. I think that is the future of to be able to really sell with hard data that we can create true efficiencies of what that looks like.
Right.
I know that's pretty wonky, but
No,
it's the
I
world
love
we live in,
monkey.
right?
I love it. And I do think that, it's also that intersection, or that, where healthcare is siloed, where we need to work on that, right? I mean, that interplay between nursing homes and whatever the healthcare facility of the future for, elderly, whether that is a nursing home or becomes more assisted living and all of those things, how they interact with the hospital, and improving that space is probably one of the most important things that we can do in improving chronic disease management as people age.
Yeah.
Right.
Yeah. And I'll just sort of say too, again, it's a valuable story for the health IT vendor community. Again, our sales folks, the marketing are talking about the efficiencies that AI will deliver. And we get it, but we have to prove it ultimately. And that was one of the lessons that came out of the EMR adoption was we're investing all this stuff. What are we getting for it?
Mm-hmm.
And so that's where I'm most helpful or hopeful.
Yes.
That we will actually be able to demonstrate clearly from a scientific standpoint that AI is actually creating efficiencies in the delivery of care.
100%. Absolutely. Tell our audience how to get involved in Smart Healthcare Alliance, and what they can do. What's the next steps there?
Right. Yeah, I'm glad to. So the smarthospital.ai is our website, and in there we have information on the smart hospital maturation model that's free to organizations, healthcare organizations, to complete. And so again, we will score organizations and help them guide them along in terms of giving a roadmap of what it looks like to be able to move towards a smart hospital. We also have the smarthealthcaretech.com site. And again, that's sort of our channel where, because we are focused on the excellence of healthcare, that is sort of the channel that we're trying to then promote, what other organizations are doing, sort of the learnings, best practices. So those are the two sites I would direct folks to.
Awesome. Well, thanks so much for joining us, Lorren. It's been great to get to know you and hear about the organization and kind of the thought process that's gone into it as we, really just enter this new, transformational period within healthcare. So it's an exciting times, and I'm excited to, have you, sort of leading that journey in the assessment realm.
Wonderful.
It's great.
Thank you for having me. It's been my pleasure.
Absolutely. And for our listeners, thank you for joining us at Digital Health Talks and Health Impact Live. This is Megan Antonelli signing off.